epidemics are seasonal flu. Epidemics happen when there's an illness going on in the world, but it's isolated to one section of the country. We're having our seasonal influenza right now in the northern hemisphere. In the south, they're not. It's summertime down there. You know when it reverses, the Australian and South American countries in Africa have flu. We don't have flu up here in the summer. That's an epidemic. A pandemic, COVID-19, is when there's disease all over the world. And it doesn't matter about what the temperature is or where you are, it's a worldwide disease. What's a coronavirus? I showed you that picture. It's got little spikes on it. Coronaviruses come from animals. Influenza comes from humans. Humans transfer it back and forth. Coronaviruses come from animals. There are 7 known coronaviruses. 4 of them we don't pay any attention to because they haven't bothered us too much. 3 of them we do. SARS, severe acute respiratory syndrome, was in 2005, somewhere in that time frame. There was something called MERS, Middle East Respiratory Syndrome. That was 2014. And now COVID-19, that's the 3rd one. I just went through that recent outbreaks. Symptoms of the illness, it's COVID-19. Fever and cough. You got the flu, you have fever and cough. The one identifying symptom of COVID-19 is shortness of breath. When you have the flu, you don't have shortness of breath. With COVID-19, you do. You're going to have a cough. The cough with the flu normally tends to be upper respiratory. With COVID-19, the cough you have is a deep chest cough, a very deep, hard to expel sputum type cough. You're going to have some of the other symptoms you have with flu, fatigue, sore throat, etc. So far, from what we've seen, most illnesses are mildly ill. Most people are mildly ill. Some are infected, but without symptoms. That scares us. People walking around that have the COVID-19 virus, but they have no symptoms. They're typhoid Marys, they're carriers. And others have a mild illness that develops into pneumonia. I'm going to show you some figures as I go through these slides, some numbers. The numbers are very flexible. So far in the United States, we've only had 3,000 confirmed cases. So we don't have a lot of epidemiological or statistical information to base things on. Everything we're getting is from other countries. And other countries have different reporting mechanisms, different testing mechanisms. So trying to figure out statistically where this disease is based on what's happening around the globe, it's a little difficult. Sometimes we wonder about the results we're getting. How deadly is it? Right now, the pandemic, or the rate for the pandemic COVID-19 is anywhere from 2 to 3%. That's a lot. When you look at regular seasonal influenza that I had on the slide there, the death rate in the United States was 32,400. That's 0.1%. Here we've got a disease that's 2 to 3%. That's a large mortality rate. And these results are going to change. As we find more virus out there, we're going to have a large fluctuation in numbers. Who's at risk? All ages have been affected. The World Health Organization is telling us that the disease is highest in the elderly and in children. I can't think of a disease that isn't highest in the elderly and in children. Elderly, as we get older, our immune system starts to wane. It ages also. In children, they haven't developed a full immune system at this point until they're about 16 years of age. So you're going to have the young and the old are going to be mostly affected by any disease, only because of the immune system hasn't fully developed in children, and in us older people, it's starting to wane. Who's at risk in the United States? Right now, the current risk is low. This slide was made up about a week ago. I'd say it's approaching moderate now. We're having localized outbreaks. You've all seen it on the news. There's spots in New York City and in California. Florida's flourishing right now with virus. And we expect the we expect the disease to spread much more rapidly. I've got a slide that I'll show you later. How is it spread? Spread just like the flu. It's respiratory droplets. When you cough, or when a person who has the COVID disease or the seasonal flu, influenza, when they cough or sneeze, droplets go out into the air. It's not necessarily an airborne disease unless you walk through right when somebody sneezes or coughs. What happens when these droplets go out, they settle, they fall on things, surfaces, your keyboard. And what happens is you ingest these things through the eyes, nose, and mouth. Okay, Ricardo, you were on this keyboard an hour ago and you coughed a couple times and maybe sneezed. You've probably got droplets on here. Mohammed, you come up and you start typing something on there. You now have the virus on your hands. Okay. And what you don't want to do is touch your eyes, your nose, or your mouth. That's how it gets into your body. Your skin is a natural barrier. Viruses can't get through your skin. They're not absorbed in the skin unless you've got a cut. That's a break in the skin. So your skin is a natural barrier. Touching your face. They did a study. I mean, they get college students and they pay them good money to do this stuff, and it's really weird. They did the GoPro camera thing on college students for a 12-hour period. College students, on the average, were touching their face 400 times in a 12-hour period. So we're all touching our face a lot. I don't want to be the college student that got paid big bucks to sit there and watch somebody touch their face. But anyway, droplet transmission is by close contact. You've heard about 6 feet. When somebody coughs or sneezes, normally, generally, unless you're a super sneezer or a super cougher, it goes out about 6 feet. So that's why we ask you to stay 6 feet apart. That's not practical. We can't all stay 6 feet apart. What you want to make sure you do is, if you were just coughing, we need to be 6 feet away from you. If somebody you see in line or wherever you're at, if they start coughing and sneezing, get 6 feet away, get 20 feet away, get out of the building. You don't want to be near somebody that's coughing and sneezing. If it's not COVID-19, it's seasonal flu. How long does it survive on surfaces? Anywhere from 2 hours to 9 days. There's a lot of factors here. Temperature, humidity, wind, barometric pressure, but just be aware that the virus can stay on surfaces for a pretty long period of time. Once again, it depends on how much virus. When you were on, Ricardo, when you were on the computer, very tiny microbe that you sneezed or coughed fell on the laptop. Mohammed, when you went on the laptop or on the keyboard, you may have picked up that virus and touched your eyes, nose, and mouth. Your body's immune system can handle small amounts of viruses. We've done that since we were kids. We get exposed to a lot of things when we were kids, and we build up natural immunity. So if you get a small amount of the virus, whether it's regular flu or COVID, your body's immune response can normally handle it. But if Ricardo had a large amount, a large cough, a big droplet landed on the keyboard, and Mohammed went and touched it, and somehow touched his face, eyes, or mouth, that's more than the body's immune system can handle. It's too much disease, too much infection. So that's where you start getting the symptoms of the disease. Viral disinfectant wipes and cleaners. I probably haven't cleaned this thing in 2 years. A couple of days ago I cleaned it because I read something about you need to clean your cell phone. Why? I don't know about you guys, but my cell phone is all over the place. It's on desks when I'm in meetings. I take it to the bathroom with me. When I'm eating in a restaurant, it's on the table. It goes everywhere. These things are highly infectious with all kinds of things. We checked with the manufacturers, and the way to, who the hell is calling? The way to disinfect these things is to take a disinfectant, a wipe, let it dry out a little bit. You don't want to put a lot of fluid around the cell phone, but just then wipe it down. Make sure you take off the case and wipe the back and inside of the case too. These are, in today's society, this is the most infectious object we have, is our cell phone.
Oh, it's okay. We're that type of company. Go right ahead.
Okay. Let's see, the viral disinfectants, okay. How is it spread? One person with a virus, whether it's flu or COVID-19, can infect 2.5 persons. That's the average, they tell us. 2.5 people from the influenza virus or COVID-19 virus, that's higher than influenza. Influenza is actually only about like 1.8%. I mean, we're crunching numbers here and it's really not significant. much lower than SARS, the severe acute respiratory syndrome, but much higher or lower than measles. Measles is one of the most infectious diseases we know. It spreads very rapidly. It's very infectious. Whenever we get a case of measles, and thankfully we don't get many, we jump on it right away. It is a highly infectious disease. And it used to be, measles used to kill a lot of people till we started getting vaccinated for it. What's the incubation period? Ricardo, once you've been exposed, say Muhammad he caused the virus. He's the virus carrier. If you come in contact with him, it's going to be anywhere from 2 to 14 days before you start developing symptoms. Again, how much virus did Ricardo pass on to you? Was it a small amount? Was it a large amount? So that's where the 2 to 14 days comes in. Normal average incubation, and this is what we're getting from the global epidemiologists, we don't have a good number for the United States yet, is about 5 days. So once the time you're exposed, Mohammed, you became exposed to Ricardo, in about 5 days you're going to get seriously ill and you're going to die in 2 weeks, okay?
Okay.
Okay.
A bit bad.
Don't tell Libby that. But.
Is there a test? You've all heard about on the news about tests. We have some tests in Erie County. There's a big problem with the rest of the world has developed a very good rapid testing system. Millions of test kits are out there. The United States has lagged behind. There are political and manufacturing reasons for that, but finally we're getting our butt together and getting the tests out there. What's going to happen is probably in the next couple of days, if not in the next week, you're going to see a large rise in the number of people who are confirmed positive for COVID-19. All of a sudden, well, I can tell you what happened today. When I first gave this lecture this morning at 10 o'clock, the confirmed cases in Pennsylvania were 79. About a half hour before I came here, I checked the site again. We're now up to 96. So it's happening very rapidly. As we get more test kits, we're going to see more virus arising. Can face masks protect you? Surgical masks. These are called surgical masks or face masks or painter's masks. Painters wear this when they're painting because of the fumes, especially when they're using sprayers. These masks fit on your face, but they're very loose. All kinds of air and can get in behind these things. They are also very permeable. They let things in. They stop particles. You may see a lot of people in East Asia wearing these masks. Part of it's a cultural thing. They're trying to be kind to their neighbors, but a lot of it is there's so much coal dust in parts of China anyway. They wear this to keep the coal particles in the air, keep themselves from ingesting the coal particles. So these masks are designed, if a person is sick, we put these on a sick person so that when they cough or sneeze, the virus is contained in here. This is what we call an N95 mask. These are what medical personnel are wearing. This mask will filter out 95% of all the particulate matter out there in viruses. These things you can't get them anymore. The medical community has a control of all of these right now. But these things you don't just put on. You have to go through a testing process. They call it a form and fit. You have to be fitted with these things. They come in small, medium, and large. And when these are put on properly, and you know how to put them on and fit them tightly to your face, we'll then take a can of air freshener and spray it in front of you. If you can't smell the air freshener, then you have this thing on properly. If you can smell the air freshener, you need to go back and do a form and fit and figure out how this will fit onto your face. So these are very good, and these will protect you from just about any virus. But again, we're not going to see the general public getting these masks. What can you do to protect yourself? I just have a couple reminders on there. Wash your hands. I talked about when you touch things, that's how you pick up the virus. It would be rare if you picked up an airborne virus. That doesn't happen very often. Usually people touching things, picking it up and getting it in their face. Wash your hands. Soap and water is good. It's excellent. It's the best thing you can do wash your hands with soap and water to get rid of any virus, any bacteria on your hands. When you wash your hands, you've all gone to restaurants and seen people wash their hands after coming out of the commode. They run their fingers under the water and shake them off, and that's good. Or they'll put a little soap on their hands and go like this and dry them off, and they think that's washing their hands. Washing your hands is washing your hands vigorously, around between the fingers, around the thumbs, etc., for 20 seconds. We tell kids to sing happy birthday twice or count to 10 and then do it again. But 20 seconds is a good hand washing. So if you think you're in an exposed area or may have been exposed to either the COVID-19 or the flu, wash your hands. Okay, you're in a place where there's no soap and water. What are you going to do? That's what hand sanitizer was developed for when there is no soap and water. Hand sanitizer is 60% alcohol, and that's what you use if you're not near soap and water. If you have the choice, soap and water versus hand sanitizer. Again, when you see hand sanitizer, I was just up at, I don't know where I was this weekend. I saw somebody, they had hand sanitizers on the wall. Persons walking by were putting their hand under there, getting a little bit of foam on their hand, doing this, and that was it. No, when you use hand sanitizer, same thing. Use it until your hands are dry from the sanitizer. As you know, your hands are real moist when you use the sanitizer, so just keep rubbing them until they're dry. Down at the very bottom, I talk about a 2-week supply or backup. A lot of us have a 2-week supply. We think about hurricanes or tornadoes or snowstorms or ice storms here in Erie, and we've all been taught, oh, the electricity's going to go out, the water may go out, so get bottled water, make sure you have enough food, enough medical supplies. We're talking a little bit different here, a 2-week backup for a pandemic. You need to have enough food and medications for 2 weeks. If we tell you that, Ricardo, you're infectious, you need to stay home for 2 weeks until you start to feel better. We're going to quarantine Ricardo for 2 weeks. So he needs to have everything he needs at home to last for 2 weeks, or have somebody that will bring stuff to him. Enough food. You don't need bottled water. We do not expect the electrical or water supplies to fail during a pandemic. But enough food, enough medications. If you're on special medications, make sure you have at least a 2-week supply. You need to have a lot of beer because you're going to be sitting around watching TV a lot. And
it's a lot tougher now.
And you need to have batteries because you're going to wear out that TV remote while you're drinking your beer, okay? So batteries, food, and beer. You're good. And medicines. Can you catch a virus from someone even before they have symptoms? We don't know. We don't know that yet. It's unknown. Can you get infected after you already had the disease? We don't know. Once you get the flu, if you get the vaccination, you got a 40 to 50% chance of not getting the flu. If you get the flu and you haven't had a vaccination, you're probably immune because your body has built up an immune response to the flu. But if anybody has ever had the flu, it's a nasty disease. It can knock you down real quick. Should you be concerned? Yes, you should be concerned. And I'm sure you know in your communities you have people with a high anxiety level and a low anxiety level. Some people are taking this much too seriously. And I know we have some young college students running around this county anyway who are taking it less seriously than others. So there's nothing we can do about anxiety levels, except encouraging people to just take care of themselves, be safe out there. Okay, this disease started in Wuhan, China, which is right about here. And it started in December of 2019. I told you the coronaviruses come from animals. They think it came from bats. Nobody's sure yet, but we're going to blame bats for right now. Started in Wuhan, China in December of last year, and in 3 months, it's gone worldwide. That is a rapidly spreading disease. Diseases don't normally go global in 3 months. So this thing is very infectious and it's spreading very rapidly. Isolation and quarantine are terms you're going to hear. Isolation is if you're sick. Ricardo, you're sick. You're not sick enough to go to the hospital yet. You just don't feel good. You test positive for COVID-19, so we tell you to stay home for 2 weeks until your symptoms are done. We'll retest you at the end of 2 weeks, and if you test negative, you're on your way. Quarantine is Mohammed, you've been exposed to him, but you don't have any symptoms. But you know you've been exposed to a highly infectious patient. So we're going to quarantine you at home for 2 weeks. That's where you have to stay home for 2 weeks and watch TV and drink beer and do all that good stuff. Can we enforce this? Legally, yes, we can, but we don't have the personnel to go out there and make sure that Ricardo stays home for 2 weeks or that Mohammed stays home for 2 weeks. We have to depend on people to be concerned enough to not want to infect other people. Does this work? We know that Japan and South Korea are going through it right now, and surprisingly in those two countries, the disease is starting to plateau or starting to lower a little bit. And that's because 80% of the population has adhered to quarantine and isolation. Culturally, I don't think we in the United States are going to have that kind of a success rate, but this is what we're encouraging in isolation and quarantine. Travel, you guys know better than I do what you can or can't do travel-wise right now. Things are pretty much shut down. Drugs and vaccines. If you got the flu, I got antivirals I can give you that will lessen the symptoms, make you feel better. Or I can give you a vaccine early in the flu season, and you've only got a 50-50 chance of getting the virus, the influenza virus. COVID-19, no antivirals, no medications, and no vaccines. We have nothing we can treat you with if you get sick, except like when you get sick with the flu, you stay home, drink plenty of fluids, take Tylenol or Advil or ibuprofen, whatever, to keep the fever down, and rest, and you will get better. Like I said, right now the illness is, according to the World Health Organization, only mildly affects most people. Hand washing. I'm going to end the lecture right here. This is the single most important thing you can do, is wash your hands. The other thing you're going to do or see, and you're all aware of this because it happened just 24 hours ago, social distancing. The president, the governor, county executive, they shut everything down. I guess I don't have the one slide. Okay, I don't have that slide on here. Let me tell you what happened we can't plan for pandemics. We play all kinds of tabletop games and exercises about the flu or smallpox or measles or something, but pandemics are so large, there's just no way we can plan for it. The only thing we can do is follow history. In 1918, there was the Spanish flu. This thing is almost an exact replica of the Spanish flu. Spanish flu, they say, killed about 30 million, or 30% of the world population died between 1918 and 1919 from the Spanish flu. Highly infectious, high mortality rate. What happened here in the United States is it started in Europe, and it's called Spanish flu. It had nothing to do with the Spanish. That's why we try not to label diseases with country or city names anymore. Had nothing to do with Spain. It just got the name Spanish flu. Here in the United States in the spring of 1918, we had a little bit of flu. It looked like flu. We weren't too worried about it. No problem. What also happened in 1918 was World War I. We sent tens of thousands, if not hundreds of thousands of young Americans over to Europe, where this flu was building up a little more rapidly than it did in the United States. They came back on ships, tens of thousands, if not hundreds of thousands of them came back to the United States. Philadelphia, in October of 1918, had a large victory parade. Lots of soldiers, lots of people, streets were lined. Within 3 days, they had 650 deaths from the Spanish flu. At the same time, St. Louis went into total shutdown. Now, I'm sorry I don't have the slide in there. It's on something I didn't send you. In Philadelphia, in a 6-week period, 72,000 people died. 72,000 people died in 6 weeks. St. Louis went into total shutdown. They did what we're doing right now. Shut down churches, schools, restaurants, bars, all kinds of businesses. They went into total lockdown. They had police on the streets, not telling people to get back in the house, telling people don't congregate, stand 6 feet apart, get away. Their total mortality rate for the same period of time, 6 weeks, Philadelphia's 72,000, St. Louis was 700. Social distancing works, and that's what we're pushing right now is social distancing. Okay, any questions? Yes, sir.
The numbers that you shared earlier for the 2%
Yeah.
mortality rate, were they tabulated including the diversity of world reporting, or are they still heavily weighted on China's numbers?
Heavily weighted on China's numbers. We have to, we didn't come up with those numbers. We're taking, I took those from WHO, the World Health Organization. When we talked about the elderly, in this country, elderly is considered 65 and above. Some countries it's 50 and above. Other countries it's 60 and above. Other countries it's 65. So when we say elderly, there's a large span of the groups that they're looking at. So when you try and epidemiologically put those numbers together to come up with a recommendation, it's kind of a soft number. It doesn't work real well.
All right. You were also talking about the numbers spiking potentially because testing isn't currently being done, so testing is going to inflate those numbers. Is there an anticipated time frame when this will plateau? I understand it's already plateaued in China. So what's our kind of peak?
Okay, it's plateaued in China because the Chinese tell us that. We have no outside World Health Organization observers going into the country that I'm aware of. I haven't read anything where they've done some independent reviews and epidemiological investigations of what's going on there. We know it's working in Japan and South Korea. Their death mortality rates are nowhere near that 2 to 5% that we're seeing here. Their numbers are very, very low. And like I said, a lot of it is cultural. We're not going to be that lucky here in the United States, but don't be alarmed when you see the large numbers rise. It's because the testing kits are out there, which means that we got a lot of people that have COVID-19 and they aren't being tested. We haven't tested them so far, so COVID-19 is in the community. It's here. And we're just going to start finding it very shortly as the tests become available.
Last question from my
Sure.
side. Because while we're social distancing, people are going to have the occasional cough or sneeze because it's in droplet form. If somebody is wearing fabric and coughs into their elbow, chances are that will be absorbed by the clothing?
Sure. I talked about hard surfaces.
Okay.
The disease stays on hard surfaces. That's why I didn't want to do this with you. I don't know if you coughed into your elbow, so we're not going to bump elbows here.
Fair enough.
When I walked in here, we were talking about this is so dumb, bumping elbows and touching fists. I mean, I keep my hands in my pocket and I say, "Hi, Ramsey, glad to meet you." Anything else I can expound on?
We operate a lot in paperwork. What can we do to, besides obviously the minimization of paperwork with outside sources, like what can we do when they come in, if anything?
Okay, I was giving this lecture to the mayor's office yesterday, and we talked about they're worried about money coming in, money being infected. Since the day money was first printed, when Gutenberg invented the printing press, money has been infected. Money is probably one of the most infectious objects outside of your cell phone that we touch. A dollar bill is a petri dish, a living petri dish. There's all kinds of viruses and bacteria on money. People don't get sick from handling money. Well, not that we're really aware of. It's just one of those objects, one of those things that thankfully the amount of viruses and bacteria are small. What you can do with all your paper is when the sun comes out, ultraviolet light is a natural disinfectant. So lay all your papers out in the parking lot and let the sun shine on them for an hour.
Got it.
I have no idea how to tell you to get the...
But actually, we could install an ultraviolet light.
Well, that's what we do at the health department for TB. When TB patients come in, we put them in a negative flow room with ultraviolet light. Not to protect them, but to protect our workers, our nurses, when they go in there to interface with the patient.
Okay. I can do that.
Bottom line is just be careful, please. You know how to, we've been dealing with the flu for decades, but we've all become numb to taking precautions. I don't take precautions. I didn't take precautions for the flu. I've been dealing with the flu since I was born. I mean, it just happens, and we don't think too much about it. We now need to think about those things they tell us about the flu, hand washing and social distancing especially.
All right.
I hope you can pass this information on to your clients. I hope that it gives you some background when they have questions that you can answer. If you have any major problems, please come and talk to me. I know that the refugee population is a population that, what is it, 2,000, 3,000 in Erie County?
10 to 12,000.
Oh, that, I didn't realize it was that high. Okay, so they're a significant part of the population. We, I know you guys are working on getting the information out there. You've got all the basic information. I've seen it in 6 languages, Nepalese and a few others. If you need anything else from us, let us know. We'll be happy to help you. We just want to stop this thing. You know they're shutting down schools for 2 weeks and businesses for 2 weeks. This is going to go beyond 2 weeks. You're looking at 6 to 8 weeks, if not more. This isn't going to just stop in 2 weeks all of a sudden.